Okay, so we're back on our desktop here, and we want to go ahead and start the patient encounter. Just to quickly review, what we were saying was the patients in black here are patients who haven't shown up yet, and patients in the red/orange tint there are patients who have already been seen, they've checked out. Green are ones that have been started by the providers, and you can see we even are able to track the time that they're started. And then the blue are the patients that are checked in, and they're basically waiting to get started here. So that's the ones that we want our CMAs and nurses to go ahead and pull back. So let's go ahead and get Patrick here and just double click, and this is going to open us up. And as you can see, we come into the face sheet. This is roughly the equivalent of our problem list and our medicine sheet in our current charts. And just briefly looking through here, you can see that we have the problems as far as past history here. Also, any allergies are noted, and then social history, and then previous diabetic diagnosis that have been done. On this, you see that we have the previous encounters from a month ago, yesterday's, where we were playing around with it. And then current medications are listed in this box. And then finally, any orders that are ordered or pending or previous orders are noted down here. And all this can be accessed by clicking onto the order itself. So when we start the patient, you notice one thing has changed already, in that the toolbar on the left side has now changed more specific to this patient. And as we go through here, we look and we see the face sheet, which is what brings us here. Sometimes we'll call this the SpongeBob. The patient manager, which lets us kind of do things as far as preventative care. And you can notice this patient is diabetic and has reminders set up here. So this is another powerful tool that we can use to help care for the patients better. And then if you need to get demographics, this pulls in from our PM system. So anything put in the PM comes to here. Now, if you ever need to change the demographics, you change demographics in the PM system, not in the EHR. It won't even let you here, okay? So always remember, if you have to change something, it goes through the PM as far as policies and so forth. And then we click on reminders. This may be reminders for this specific patient that they need something, whether it be a screening mammogram, a bone density, a colonoscopy. This will be specific to the patient. Also, as these come in, you'll see a number come up on the side here, so that will remind you. The flow sheet, this is something that we'll go into more detail, but this is for some of our processes that you'll be able to see the flow of some of the, whether it be vital signs or others in this. But for most patients, we're not going to be using this flow sheet. Immunizations gives you a quick look at this patient's immunization history. Also, if you need to add immunizations, this is a quick way to get to it. Medication administration. This is, for example, if we're given a Rocephin or a dexamethasone shot, this is where we're going to document that. Chart attachments, or anything that's kind of been attached to the chart, whether it be a note from another provider possibly, or documents that have been attached, so these would be found here. And then specifically lab results for this patient would be found here, and this looks very familiar if you've seen the previous videos where we look at lab results. And then procedure results for this patient, any additional results, and then there's a results summary. Otherwise, we can take a look, and this patient doesn't have much history, so there's nothing to show, but if there were results, this would show kind of summary and a trend line. So when we look at this patient, we'll go back to their face sheet, go back up to SpongeBob here. So we're going to start here. First thing we want to do, of course, is get vitals. So we come down to the contact icons here, and we click on vitals. And you can notice this patient had some vitals done yesterday, but we want to add new ones. So we press onto the green cross there, and it defaults the date and the time. And then with the vitals here, you do not have to put every single vital on the screen, but we want to get our key ones or what your providers direct you to. So for example, say our patient here weighs 245 pounds. And is 6 foot tall and 3 inches. And you can navigate by moving your cursor through, or if you want to, you can just simply tab through as well. Very similar to Windows products that you may be familiar with. So we come down to temperature here, and temperature we're going to say 98.7. And this defaults to Fahrenheit, but if for some reason you need to change it, you can. And also we've set it up to default to oral, but there's all kinds of ways to take temperatures there, so you can always get that. Electronically acquired is more if there's an interface with the computer into the system directly, so possibly in the future, but for the most part not going to be utilizing this. And then we're going to say the patient's pulse is 60, and we're going to say this is an irregular pulse. Maybe they have atrial fib or another arrhythmia, so we can add some information there. And then respiration, same thing. We can put in our rate here, and we'll say 14. And let's describe the pattern. We can say they're wheezing. And then as you look, we have pulse ox, peaks flow. This is something we do quite often with our respiratory patients, especially on their acute visits with the flare-ups. And then patient blood pressure, we can put in 120, and diastolic, we can say it's over 80. And you notice the defaults here are sitting, right arm with standard cuff size. But this person's a pretty big person, so we're going to say we used a large cuff. And for debate, we had to use their left arm for some reason. And then as far as position, you can do orthostatics in this, or you can do different vital sign position directed by your providers. Patients in for pain, you can give some a little bit more information on a pain scale here. And then down at the bottom here, these are comments that you can share to the provider that are not necessarily added to the note per se, but added to the vital signs information. So once we've got this in, all we have to do to record these is we click OK.